So looking at the muscles that work at the wrists and fingers, these can be divided up into the extrinsic muscles of the hand and the intrinsic muscles of the hand. The intrinsic muscles of the hand are those muscles that have got their proximal and distal attachments within the boundaries of the hand itself. The extrinsic muscles of the hand are muscles that are found up in the forearm that work on the digits and the fingers themselves. If we start off looking at the flexors themselves can be further subdivided into two layers. There's the superficial layer, which are those muscles that have their proximal attachment coming either in part or in whole from the common flexor origin or the common flexor tendon, which is an aponeurotic tendon that arises from the medial epicondyle and the adjacent fascia. These muscles include flexor carpi ulnaris, palmaris longus, flexor carpi radialis, and pronator teres is often grouped in with these muscles as it has the same common proximal attachment as well as a common nerve supply with them. Underneath these superficial muscles, we have flexor digitorum superficialis, which is also part of the superficial layer, although sometimes it gets classified as an intermediate layer all by itself. So starting off with flexor carpi ulnaris, so up here we've got, there's our medial epicondyle, there's the lateral epicondyle over there. So the medial epicondyle, so we've got biceps coming down here at the front. Medial epicondyle, the first muscle that we can see in our superficial layer is over here. We've got pronator teres, that's a short, thick, round muscle that assists with pronation of the forearm. Coming right over to the other side, over to the side where the little finger is, there is flexor carpi ulnaris. And flexor carpi ulnaris has two heads, the humeral head that comes from the common flexor origin up here, and then the ulnar head that comes from the medial border of the olecranon process and the posterior border of the ulna itself via a large aponeurotic tendon. Forms a long tendon that goes off and inserts into the pisiform muscle. It invests pisiform. Pisiform itself is a sesamoid bone that sits inside the tendon of flexor carpi ulnaris, and the tendon goes on to attach to the hook of hamate and the base of the fifth metacarpal. The actions of flexor carpi ulnaris is to assist with the movement of flexion and to assist with the movement of ulnar deviation or adduction of the wrist. Its nerve supply is from the ulnar nerve roots C8 and T1. Lying next to flexor carpi ulnaris, so there we've got flexor carpi ulnaris again. Over here, we've got a muscle called palmaris longus. This is palmaris longus coming here into the aponeurosis of the palmar fascia. And it arises directly from the common flexor origin. It passes down lying over the flexor retinaculum before blending into the palmar aponeurosis itself. Now, palmaris longus is a muscle that is devolving, so not everybody has a palmaris longus. Some people will have a palmaris longus on one side and not the other, and some people have no palmaris longus at all. Its action is as a weak flexor of the wrist, but it also tightens up the palmar fascia. Its nerve supply is via the median nerve C8-T1. Flexor carpi radialis is this structure here. There is flexor carpi radialis FCR running down here under the flexor retinaculum. Again, its proximal attachment is the common flexor origin, forms a long tendon that passes under the flexor retinaculum in its own separate compartment and it splits into two and inserts into the bases of the second and third metacarpals on the palmar aspect. Its function is to produce flexion and radial deviation. Now, when flexor carpi ulnaris and flexor carpi radialis contract together, they will produce the pure movement of flexion. They will cancel out each other's radial and ulnar deviation tendencies, and we will end up getting the movement of flexion of the carpus itself, so flexion of the wrist. The nerve supply to flexor carpi radialis is the median nerve, C6 and C7. So, peeling back those muscles, we've then got a muscle that sits underneath these four muscles. So underneath pronator teres, flexor carpi radialis, palmaris longus, and flexor carpi ulnaris. Here we can see flexor digitorum superficialis. Again, it has two heads. It has a humeral head that comes from the common flexor origin and the medial border of the coronoid process, and a lateral head that comes from the upper 2/3 of the anterior oblique line on the radius, which is a horizontal ridge, an oblique ridge, sorry, passing across the anterior aspect of the radius itself. It runs down, forming 4 tendons that pass underneath the flexor retinaculum in a synovial sheath that is shared with flexor digitorum profundus before they go on to insert into the palmar aspect of the intermediate phalanges of the 4 medial digits, so the 4 fingers themselves. At the level of the metacarpophalangeal joints, the flexor digitorum superficialis splits. So in this diagram here, we can see the flexor digitorum superficialis coming down on the palmar aspect of the hand. Here's the split, this beautiful split here that creates, they almost look like 2 ribbons that wrap their way around flexor digitorum profundus tendon. They then reunite before splitting again and inserting into the intermediate phalanx of each digit. This anatomical arrangement has the effect of stabilizing the 2 tendons. They stabilize each other, preventing a component of mediolateral bowstringing. The action to flexor digitorum superficialis is that it produces flexion at all of the wrists, all of the joints that it crosses. So the anatomical wrist joint, the metacarpophalangeal joints, the proximal interphalangeal joint. It does not produce flexion at the distal interphalangeal joint. That honour is reserved for flexor digitorum profundus. Again, nerve supply from the median nerve C7, 8 and T1. Deep to the superficial muscles, we have 3 muscles: flexor digitorum profundus, flexor pollicis longus, and then pronator quadratus. Again, that gets grouped in with the deep flexors of the wrist and digits. Although it's a pronator, it gets grouped in because it shares a common compartment and because it has a common nerve supply. Flexor digitorum profundus is a fairly stout muscle. It arises from the medial side of the coronoid process and from the anterior aspect of the upper 3/4, upper 2/3 of the shaft of the ulna. It also has a partial attachment onto the middle half of the middle portion, onto the medial half of the middle portion of the intraosseous membrane. It forms 4 tendons, again, that pass underneath the flexor retinaculum, sharing a common synovial sheath with flexor digitorum superficialis. As the tendons pass off towards their distal attachment, they pass through the split that was described earlier in flexor digitorum superficialis. So here, again, we can see flexor digitorum superficialis splitting, going off to the intermediate phalanx. There is profundus lying deep to it. It goes through the split in superficialis before going off and detaching onto the distal phalanx of the 4 medial digits. Now, the action of flexor digitorum profundus is to produce flexion at all of the nerves that all of the joints that it crosses, which include the wrist joints, the MCP joint, the proximal interphalangeal joint, as well as the distal interphalangeal joint. And flexor digitorum profundus can get injured, it can rupture, and when it does rupture, the individual is often not able to flex that distal interphalangeal joint. And the classic sign that we see is we get this kind of awkward looking fist, one digit that cannot quite close itself in. These structures can get injured, or most commonly get injured in individuals that do high load activities on using the tips of their fingers. So climbers, this is typically a climber's injury. Okay, so lying lateral to flexor digitorum profundus, we've got flexor pollicis longus, and here you can see flexor pollicis longus again arising from the anterior surface of the radius below that anterior oblique line, so lying under cover of flexor digitorum superficialis. It runs down under the flexor retinaculum in its own little synovial sheath before passing all the way to the base of the distal phalanx of the thumb. Its action is to produce obviously flexion of the interphalangeal joint of the thumb, the MCP joint of the thumb, the metacarpophalangeal joint of the thumb, the carpometacarpal joint, and the wrist joint itself. Again, the nerve supply to the deep flexors is via the intraosseous nerve, mostly via the intraosseous nerve C8 and T1. As all of these tendons pass off to their distal attachments, there is a strong thickening in the palmar aspect of the deep fascia. This is known as the flexor retinaculum, and the flexor retinaculum is firmly attached to pisiform over here, to the hook of hamate, to the tubercle on trapezium and the tubercle on scaphoid, and it has the effect of converting the carpal bones into a tunnel, and this is known as the carpal tunnel. Condition carpal tunnel syndrome is well known, very commonly seen in pregnant women, in people who have heavy impact in this region. So cyclists can sometimes develop carpal tunnel syndrome. Labourers who work on drills, for example, as the drill thumps up into the carpal tunnel, you can get irritation in this area, and you get all the symptoms of carpal tunnel syndrome. Here we can see a cross section, so we can clearly see here, there's my radius, there's my ulnar on this lower picture. Up here we've got the distal row of carpal bones, so that's the hook, that's hamate with its hook, capitate, trapezoid and trapezium, and the flexor retinaculum goes straight across. It sits like a lid over the anterior aspect of these structures. The tendons of flexor digitorum superficialis here in purple and flexor digitorum profundus here in orange pass under the flexor retinaculum, along with this small structure, this yellow structure that we can see here, which is the median nerve, and then next to that we've got flexor pollicis longus. Flexor carpi radialis passes here separately in its own little compartment, in its own separate tunnel. Palmaris longus and flexor carpi ulnaris go over the top of the flexor retinaculum. The function of the flexor retinaculum is to hold the tendons of the flexors down to prevent bowstringing whenever we flex our wrist. Carpal tunnel syndrome itself is where the flexor retinaculum creates pressure or compresses onto the median nerve itself, and that gives you pins and needles into the digits. As these tendons pass under the flexor retinaculum, they do so in a synovial tendon sheath. And these synovial tendon sheaths are a double layer of synovial membrane that have a thin layer of synovial fluid in between, so that as the digits flex and extend, the two layers of synovial membrane slide past each other, preventing friction between the tendon and their surrounding structures. Flexor digitorum superficialis and profundus share a common sheath. Flexor carpi radialis has its own separate sheath, as does flexor pollicis longus. Where palmaris longus and flexor carpi ulnaris pass over the flexor retinaculum, they have no synovial sheath at all.